Good morning. My name is Dr. Sarah Cook. I'm a family physician practicing in the Northwest Territories, and I serve as president of the College of Family Physicians of Canada, representing more than 47,000 family doctors across this country. I'd like to begin by acknowledging that we are gathered on the unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. I live and practice on Chief Dry Geese territory, which is traditional home of the Yellowknives Dene First Nation, and my original home is Mi'kma'ki, Nova Scotia. Every Canadian deserves access to a family physician. Tout le monde au Canada devrait avoir accès à un médecin de famille. Not just access to any care, not episodic care, not a walk-in when things fall apart, but timely, continuous, coordinated care with a family doctor who knows them. And yet today, nearly 6 million Canadians do not have access to a family physician. That is not a marginal issue, it is a design failure. We know that attachment to a family doctor is one of the strongest predictors of better health outcomes. It also reduces cost. Care by family physicians decreases emergency department use and hospitalizations. It also reduces cost. And as a family physician in Canada's North, I can tell you firsthand that family doctors do so much more in addition to running community-based clinics. We staff hospitals, we deliver babies, and we provide emergency care. Family doctors truly are the backbone of healthcare in Canada. But here's the reality. We don't have enough family doctors. But what's more, the system is not creating conditions to optimize and support the family doctors that we do have. And that is something that we can do something about. Today, I want to focus on practical, immediate steps that the federal government can take to optimize the people that we do have in family medicine to strengthen access. I'll focus on 3 areas, 3 levers, real impact. First, reducing administrative burden. Second, digital interoperability. And third, viable practice setup for early career physicians. So first, let's unlock existing capacity by reducing unnecessary administrative burden. Family physicians report spending on average 10 to 19 hours a week on administrative tasks. Let me illustrate this. There's a term that we use called pajama time. It refers to the hours that physicians spend at home, often late at night in their pajamas, completing administrative tasks that they couldn't finish during the workday. This is in addition to time spent during the day, which could have otherwise been spent in direct patient care. It is no wonder that nearly half of us report high levels of burnout. The fastest way to increase access to care in Canada is to give family doctors their time back to do what they are trained to do, and to do so sustainably. The federal government promised nearly $500 million to reduce administrative burden, and that commitment needs to be fulfilled. There are a number of solutions that we can tackle, but let me highlight 2 that need federal leadership. First, there is a federal government form called the Disability Tax Credit Form, which helps reduce the income tax that people with physical or mental impairments may have to pay. Family doctors are unnecessarily used as gatekeepers. This form is 16 pages long and can take up to an hour to complete. Just under 500,000 disability tax credit forms were completed in 2024. The time spent filling out that single form by family doctors last year could have equaled roughly 1 million patient visits. And with the rollout of the Canada Disability Benefit, this demand will grow. This is solvable. Allow automatic eligibility where appropriate, expand who can certify, and don't use family doctors unnecessarily as gatekeepers for this form. A second area for federal action to decrease administrative burden is long-term funding for AI scribes in family practice. These tools safely automate documentation and note-taking. They can save 3 to 4 hours per physician per week, and they have the added benefit of allowing doctors to engage more directly with patients in a visit, rather than typing on a computer. That time translates directly into more patient visits and more sustainability for physicians. The Disability Tax Credit and AI Scribe are just 2 potential solutions, but both are achievable and both can have significant impact. Reducing administrative burden is not about convenience, it is about capacity. Let's talk about the second lever to optimize family physician time. Efficiency and safety through digital interoperability, ensuring that health information is connected and accessible regardless of location of care. As a physician, there's almost nothing that frustrates me more than not being able to access the information I need to safely care for a patient. Currently, health information systems in Canada largely don't connect to one another, meaning that your health information can be fractured into multiple systems with no single coherent record. Let me illustrate an example. Recently, one of my patients became critically ill while traveling in Ontario. She called me from her hospital bed, looking for advice. I was skeptical that I could access her records to help her, but she was able to give me digital permission. And from 5,000 kilometers away in the Northwest Territories, I was able to review her admission notes, her labs, imaging, consult notes, and help her make a decision about her location of care. This is how it should be. Patient control of their own health information, sharing necessary access within their circle of care, no legislative barriers, no extra software to purchase, no interoperability issues. It was simple. But I was shocked because this is an anomaly. Contrast that with what happened next. When she later required care in Alberta, using the exact same digital platform, but in a province that blocks access for any patient without an Alberta address, we were back to faxing and missing information. Her care slowed down, not because of medical complexity, but because of restrictive policies. The reintroduction of the Connected Care for Canadians Act, Bill S5, is an important step to mandate interoperability, but it's just the first step. If Canadians can travel from clinic to clinic, city to city, and across the country, their health records should be able to as well. We urge federal policymakers to take leadership and adopt the new Connected Care for Canadians legislation quickly and ensure that it's supported by a robust set of regulations to achieve real improvements soon. Finally, the third lever. If we want every Canadian to have a family doctor, we need to ensure it is viable for family doctors to sustain comprehensive primary care practices. I recently spoke to an early career family physician. She loves full-scope family medicine, hospital work, maternity care, and comprehensive longitudinal primary care. But when I asked if she planned to work long-term in a community primary care practice, she hesitated. Not because she lacks commitment, but because she's unsure that whether she can afford it. And working in a hospital seems much more attractive. Before seeing a single patient in a primary care clinic, new family doctors have to face lease costs, staff salaries, technology and equipment purchase. For many, overhead expenses can be as high as 75% of their income. So many choose locums or specialized practices or working in hospitals. The federal government promised $300 million to support new family practices. That fund needs to be implemented. A well-designed new practice fund would offset startup costs, stabilize the early years of practice, encourage comprehensive cradle-to-grave care, and signal to medical students that family medicine is viable and valued. If we want more Canadians attached to family doctors, we must make it possible for family doctors to attach to communities. So let me come back to where I started. Every Canadian deserves access to a family physician. Right now, 6 million do not. This is not inevitable. It is the result of policy choices, and it can be improved by policy choices. Réduire le fardeau administratif, moderniser l'infrastructure numérique, financer l'ouverture d'une nouvelle clinique. These are not abstract ideas. These are practical steps. Strengthening family medicine is not a cost. It is one of the most productive investments Canada can make. Because when Canadians have access to family doctors, they are healthier, they use emergency department rooms less, the system works better, and the costs are controlled upstream. There is no substitute for family doctors, and there is no stronger foundation for Canada's health system. Thank you. I look forward to your questions.
David Baxter here from the Canadian Press. Have you had any recent meetings with the health ministers to talk about progress on these federal initiatives here?
I haven't myself, but I'm hoping to soon, and we'll be meeting with the Minister of Health's parliamentary secretary later today.
And just, what are going to be some of the primary things you're pushing for there? Just if you had to just kind of rank order of operation here for where you want to see the feds take action first.
Yeah, so I think specifically these three things that I've mentioned. So reducing administrative burden by reducing the burden on family physicians specifically for forms like the disability tax credit form, having long-term funding of AI Scribe, digital interoperability, so ensuring that the Connected Care for Canadians legislation is passed and enacted with regulations, and also making sure that that new practice fund that was committed to by the government is actually put into place.
Any more questions? Is there something you would like to add to your statement?
Sure. In closing, a survey found that 91% of Canadians agree that the federal government should do more to make sure that everyone in Canada has access to a family doctor. And when 91% of Canadians agree, that's not debate, that's a mandate. There are solutions within reach that I've summarized this morning, and now it's time for action. Thank you.
Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
One question, Brendan, APTN. In the territories, Yukon, Northwest Territories and Nunavut, is the situation the same or how is it different for family doctors or medical care?
Yes. The situation is challenging across the country. We particularly have health and human resource challenges in the three territories where we are very reliant on visiting locum physicians to be able to provide the care that we need. There was an interesting report, the Our Care report, that came out recently that finally included territorial data and shows that the sentiments are fairly similar in terms of what Canadians want and expect from primary care and from family physicians, and that many still don't have access. The question asked in that survey asked about access to primary care in general, which included access to other forms of primary care, including community health nurses, nurse practitioners, family physicians. But most people, particularly in my territory, do not have access to their own family physician. So it's a big challenge.
Thank you. Merci.
Thank you.